control during coagulation. Here at Sketchy, we decided to share our love for video games by taking you inside to play a few rounds of Call of Warfare. But before we get started, let's draw the setting. What's so special about vitamin K? For one, there are two main natural forms of vitamin K, phylloquinone, menaquinone, and several synthetic forms. Also, it's fat-soluble just like the other vitamins A, D, and E. Where can I get a chubby stuffed rat? Maybe a pizza place somewhere? And where do we get vitamin K? Well, the main source is leafy green vegetables. Bacteria residing in our colons can also make vitamin K, specifically menaquinone. Now find a beanbag chair, preferably a colon one, because things are about to get messy. Before vitamin K can start working, we first need to activate it. Vitamin K epoxide reductase, or VCOR, turns oxidized inactive vitamin K into the reduced fully functional form. It's almost time to play the game. Just gotta scrape some dust out of this cartridge first. Ow! I sliced myself. Fortunately, I have these gamma bandages in a cardboard box, which will also remind you of gamma-glutamyl carboxylase, or GGC. This enzyme catalyzes the post-translational modification of the vitamin K-dependent proteins. GGC uses vitamin K as a cofactor to add a carboxyl group to glutamic acid residues on factors 2, 7, 9, 10, protein C, and protein S, represented by the pool balls. This carboxylation step is required for normal hemostasis because it enables calcium binding and subsequent activation of the vitamin K-dependent proteins. Alright, now that you know why vitamin K is important, we can go over the causes of vitamin K deficiency. Not surprisingly, not being able to break down or absorb fats may lead to vitamin K deficiency. The most common examples are pancreatic insufficiency due to cystic fibrosis and celiac disease. The Spill milkshake will help you remember fat malabsorption. Another reason for developing vitamin K deficiency is taking broad-spectrum antibiotics for extended periods because they eradicate vitamin K producing gut bacteria. We'll use our recurring symbol for broad-spectrum antibiotics, the broad-spectrum prism, to highlight this fact. Get it? Light? Because I said highlight. Anyways, let's play Call of Warfare. Let warfare remind you of warfarin. Patients taking warfarin can have symptoms mimicking vitamin K deficiency because warfarin blocks the enzyme responsible for activating vitamin K, VCOR. Newborns are more likely to develop vitamin K deficiency. There are 4 reasons why. First, breast milk is very low in vitamin K. Second, newborns don't have a fully developed liver, so they can't efficiently utilize vitamin K. Third, newborns don't have any vitamin K producing gut bacteria. Yep, their guts are sterile, just like this baby's clean bottom. And finally, vitamin K doesn't cross the placenta. Okay, so the placenta isn't exactly broken per se, but just remember that it can be the cause of some problems here. We'll also draw a syringe rattle toy as a reminder that newborns should receive intramuscular vitamin K at birth to prevent deficiency. Alright, the next part is super high yield. Let's go over the key findings in vitamin K deficiency. As you can probably guess, not having enough vitamin K means you're probably going to bleed everywhere. This is what's known as a bleeding diathesis. Patients can present with a range of symptoms. On an exam question, look for keywords like easy bleeding or bruising, bleeding gums, hematuria, hematochezia, hematemesis, or melena in an adult with fat malabsorption or a newborn who didn't receive medical care at birth. There's even a special name for newborns who excessively bleed because they don't have enough vitamin K. Hemorrhagic disease of the newborn, also called vitamin K deficiency bleeding, or VKDB. What we're most concerned about is intracranial bleeding, depicted by the newborn's red hair. You might be asked a question on intracranial bleeding in a newborn who didn't receive IM vitamin K for whatever reason and is exclusively breastfed, presenting with lethargy, fussiness, altered sensorium, and head swelling. Physical exam might reveal increased head circumference, bulging fontanelles, and ocular dysfunction. They may have some bruises or dry blood around the umbilicus and elevated intracranial pressures. Okay, so what are some lab findings you should remember for VKDB? Look for prolonged PT and PTT but normal bleeding time. To remember PT and PTT, think of this paratrooper shooting his gun. Please check out our acquired coagulation defect sketch in Sketchy Path to learn more. Fortunately, we can prevent these complications by giving IM vitamin K to these babies, but let's just say it's too late for that. How do we make them stop bleeding? Giving them parenteral vitamin K is a start. You might consider fresh frozen plasma or prothrombin complex concentrate for severe bleeding episodes. They contain the clotting factors to help stop the bleeding faster. Finally, this may seem obvious, but you'll want to administer vitamin K and PCC in a patient who you suspect overdosed on warfarin. Alright, let's review the main points before I get a game over. Vitamin K is a fat-soluble vitamin found in leafy green vegetables and made by gut bacteria. Vitamin K plays an important role during coagulation by serving as a cofactor for GGC, which catalyzes the post-translational modification of factors 2, 7, 9, 10, protein C, and protein S. Reasons for vitamin K deficiency include fat malabsorption, prolonged use of broad-spectrum antibiotics, and taking warfarin. Newborns are also more likely to develop vitamin K deficiency because breast milk has very little vitamin K, their livers are not fully developed, their guts are sterile, and vitamin K doesn't cross the placenta. Vitamin K deficiency causes a bleeding diathesis. Newborns can develop VKDB, which can cause intracranial bleeding. The lab findings for VKDB generally show prolonged PT-PTT and normal bleeding time. And finally, parenteral vitamin K, FFP, and/or PCC can be administered for severe bleeding episodes.